Tessa mentioned earlier that medicine was silent for decades, and my talk is going to be a little different from the others because instead of speaking about why this history matters, I'm going to talk about how we can teach it. Um, Many of you know we've spent the last several years in Denver, Colorado, building a program with the goal of ensuring that not only will every health sciences student in our university have the opportunity to learn about the role of health professionals in the Holocaust, but they'll also understand how this important and tragic legacy has continuing importance for medicine and society today. So I'm going to summarize for you some of the lessons we've learned while creating this program, because while building it and while trying to spread it to other universities, this has been a much harder job than I had expected. And it's been hard for reasons that were not apparent to me when I at first started it. This is an issue I've been working on for well over a decade, since the Holocaust Museum in Washington, D.C. first created its Deadly Medicine, Creating the Master Race special exhibit. When I first saw that exhibit, and I saw it before it was available to the public, it really hit me hard for two reasons. First, I realized there is hardly an issue in medical ethics today where modern thinking has not been influenced by this history, whether it's end-of-life care or high-priced drugs or the care of refugees or biomedical research or genetics. The way that we think about these issues is profoundly affected by the legacy of the Nazi doctors, whether we know it or not. And second, I realized most people in medicine don't know it. Most of us have not been taught this history. There is some education about the Holocaust in our high schools in the US and in colleges, but we do not include this history in health sciences education, except for an occasional lecture about research ethics, which might mention Mengele and the Nuremberg trials. Other than that, it is rare for the history of health professional involvement in the Nazi crimes to be included in our training. And my question was, how can we really understand modern medical ethics without understanding this history? I think we can't. And that's why I committed myself a number of years ago to helping ensure that every health sciences student would be exposed to this history. And I worked for a number of years with Dr. Patricia Haber-Rice and others at the U.S. Holocaust Memorial Museum. We developed a traveling lecture about this history, which we've delivered at medical schools around the US and around the world. And then when I moved to Colorado in 2015, some new opportunities arose. The university there already had a committed community of physicians who thought that educating students about this history was important. And as this slide shows, this group in Colorado had done several outstanding programs in the prior decade, but there hadn't been a continual program every year. And the question is why? Well, one reason was that there hadn't been someone available to run such a program, but now I'm there, and so I'm committed to this, and that issue is solved. We now have people who are committed to do this every year. But equal important, there wasn't committed funding for an annual program. So first, I have to thank Dr. Bill Silvers, because when I arrived, I got together with a number of people who'd supported the program over the years, and I made the case that we were not going to be able to do a continuous program without continuous availability of funds. And Bill Silvers, who is the son of two people imprisoned at Auschwitz, agreed to provide an initial gift to create an endowment to ensure that this initiative would move forward every year. That was an excellent and a critical first step, but let me be clear. He gave us $100,000, which is a wonderful gift. It's a terrific gift. A $100,000 endowment provides $4,000 a year. So that's not enough to run a comprehensive program across all 4 campuses of our university. So we have continued to face fundraising challenges every year. And I think anyone out there who wants to establish a program like this will need to think from the outset about where the money is going to come from. The next 2 slides illustrate some of the work we've done for the program over the last couple of years. Last year, we hosted the Deadly Medicine traveling exhibit on our campus, and we worked with Holocaust educators. We trained local docents or exhibit guides who took school groups and others through the exhibit. But it wasn't just the exhibit. Last year, we also did a series of lectures, concerts, panel discussions, and other activities, which took place on all 4 of our campuses around the state of Colorado. One of these panel discussions was particularly effective, even though we were a little nervous when we planned it. We invited 2 Holocaust survivors who had been a child and a teenager when their families escaped Europe as refugees, eventually settling in the US. And their stories were incredibly moving, as you can imagine. But then we also invited 2 young people who had fled the war in Iraq and in Syria with their families much more recently, and their stories were also powerful. But it was the combination, having them speak with each other, the older generation and the younger generation, about their shared experiences as refugees. What was similar, also what was different, that juxtaposition is what really moved the audience. Our partnerships have been critical to the growth of this program. We've worked not only with local and national museums and coalitions that share our mission, but also with our local partners like the Meisel Museum and local foundations. The M.B. Glassman Foundation has been particularly helpful for us. And this year we worked on a program with Physicians for Human Rights and others. And we also have a number of university partners. And I just put this up because I think partnerships are critical if you want to build a program that will last. Now, looking at the partnerships and the expanding program we've had for the last few years, you might think we've had nothing but success, but that's not true. We have had a solid program annually, but we still do not have a formal curriculum in our medical school or our nursing school or our pharmacy school about the role of health professionals in the Holocaust. The basic argument that I have been making for over 10 years remains true. Teaching about the legacy of medicine during the Holocaust, the Sentinel genocide and a medical genocide of our time, is critical for medical professionals, and yet it is only required in a small fraction of the medical schools in all of North America. And the question remains, why? To put it bluntly, this ought to be in the curriculum at every health professional school in the world, but it is hardly ever taught. So what are the barriers in getting this history into the formal curriculum at health sciences campuses? Separate from funding, which again is critical, I think there are 5 key issues that we have to address. And for each one, I have a few ideas for how to tackle it. So let's get started on these. Number 1, let's talk about what's probably the most obvious barrier. The scarcest resource in education is time. Ethics is a required part of the curriculum now for all medical and nursing students, but history is not, let alone the history specifically of the Holocaust. And not all the people in leadership will recognize that Holocaust education is important because, after all, they didn't learn this when they were in school. So some ideas for breaking into the curriculum are to start with elective sessions. This is what we've done. This is what Tessa has done. Many others have created elective curricula. We also created a student advisory group because if students ask for something to be put in the curriculum, it's much more likely to be taken seriously than if professors ask for additional material to be put in the curriculum. After all, professors always want to put more in the curriculum. Students do not. We're also working on building little parts of our material into existing coursework. So rather than trying to create a series of new classes, we look at the existing classes and see where we can insert a bit of this history into the existing coursework. Second, perhaps the second most scarce resource in education is a good teacher. And this topic is even harder to teach than most others, because it's very sensitive. The lessons are often nuanced, the history is complex, and because it wasn't taught in the past, we don't have a lot of health professionals who feel like they are qualified to teach about this history and why it matters today. To address this barrier, we've developed a faculty advisory group for the program. And when we had the Deadly Medicine traveling exhibit on our campus, we trained a number of them to serve as docents, walking tour groups through the exhibit, learning more in the process about this history and becoming comfortable talking about it with groups. We've also partnered with local and national groups that focus on Holocaust education. Even if they don't focus on health professionals and the Holocaust, they have a lot of experience in teaching the complex and painful lessons of the Holocaust, which is very valuable. Third, all over the world, the use of lectures in teaching in health professions schools is in decline. More information is being taught using cases and small groups, but this history is not always easy to incorporate into cases for small group discussion. This is why Tessa's textbook or casebook has been so incredibly valuable. To address this challenge, we have created an annual case competition where students who have learned about the roles of health professionals in the Holocaust develop their own cases, which we then consider using in subsequent years' programs. We give them a small money prize, plus they get the recognition and pride that comes with having something you created incorporated into the medical curriculum for future years. We've also tried to create opportunities for active learning, such as with classroom visits by survivors and tours with groups to local museums. And now I'd like to talk about one of the less well-recognized challenges with teaching this material to modern medical students. This one might be the least often acknowledged, but it's also probably the hardest of these challenges to handle. The crimes of the Nazi doctors, as we've heard this morning, have become the archetype for evil. They are so heinous. They are the epitome of medicine gone mad. And because of this, anytime one tries to compare an ethical issue that is occurring today to something that a Nazi did, it will have two primary effects. First, it will make the person who is being accused of acting or thinking like a Nazi very defensive. So it doesn't open their mind to new ideas, it tends to close it. And second, it shuts down the conversation. In the US, we call this playing the Nazi card. And it's well known that once you have told someone that what they are doing or the way they are thinking is analogous to a Nazi, you have caricaturized the issue, and the assumption is you are no longer interested in trying to understand their point of view. After all, you just called them a Nazi, which is pure evil. I do not have a perfect solution to this. But the reality is, as we have heard this morning, the Nazis were human beings, like us. And more often than not, I fear, they didn't think they were evil. Of course, today it is obvious that what they did was evil. But the lesson from all of this is that they were human beings. And human beings, including us, are capable of perpetrating evil even while thinking we are doing good. So our approach to this challenge has been to openly acknowledge how hard it is to learn from this history. This is why, in part, we were silent for so many years. We cannot take lessons easily from this history. So we do this at the beginning of every discussion about this history. And when I give my lecture about this, I start with how difficult it is to learn from this history, and I end with how difficult it is to learn from this history. And I do this as a way to try and reinforce that we still need to try. We need to try to learn from this, as painful and as difficult as it may be, to think about how ordinary human beings like us, even like me, could find ourselves on the path to evil. A second way we've thought to address this is to not start with the Nazis, but to start with a contemporary challenge that is somehow related to the lessons and the legacy of World War II. So, for example, this year's program, we focused on the roles of health professionals in wartime. We had experts on human rights law and on the conflict in Syria, and they spoke about how modern human rights law were influenced by what happened during World War II and how our response to the Syrian refugees and other refugees are a reflection of what happened in World War II and the lessons we learned or failed to learn. And third, we've invited people like Tessa Shalush to come and speak about positive stories of medical heroism during the war. And to be blunt, this is a necessary counterbalance to teaching about this history, which tends to be so overwhelmingly negative. Finally, I've been talking about challenges and how we've addressed them, but this last slide is really a plea to all of you. The history of the Holocaust is extremely complex and detailed. There's so much to be learned, and there is no recognized consensus on what are the key aspects of this history that every student ought to know. What are the key lessons that need to be conveyed from this history that will matter the most to health professionals today? So one way we've addressed this is to have a different program each year. This allows us to explore various aspects of the history and its contemporary implications. But I'll also say it is a capitulation to the idea that we don't have a core curriculum that ought to be taught every year to every student. Because different students in different years are hearing about different aspects of this history. So recently, we've established a working group of interested faculty and community members who are working on what they consider to be the core lessons that ought to be addressed every year. This group is not done with their work yet, but at the moment, they're looking at lessons in three main areas. First, the challenges of dual loyalties, when health professionals have competing obligations to individual patients and to the government or their employer or to the community at large. Second, the role of trusting science, which is always unfinished, often tentative. Medical science can be very helpful for setting social policies. But there is also a risk in believing scientific theories before they've been fully proven, especially if you plan to use them to set policies that might harm people. Third is the issue of how training to become a health professional creates special risks of losing our humanity, as Susan referred to a moment ago. It does have the risk of making us hardened or inured to human suffering. This is something all of us must be careful to avoid as we move through our training and our careers. These are undoubtedly not the only three lessons to be learned from this history, but each of these seems important, and there are specific aspects of the history that can help illuminate each of these core ethical challenges in healthcare today. So I'd like to close this talk with a question for the group, which includes so many experts on this history and its impact. What are, in your view, the key aspects of this history that every student should know? And why are they important today? What standards should we have to help guide those of us who wish to ensure that every health professional student everywhere in the world is taught what they need to know about this history and how it affects healthcare and society today? Thank you.